Sexually transmitted infections, often referred to as STIs, are a significant health concern worldwide. They can range from mild to severe, affecting millions of people each year. While some STIs are curable, others can be managed but not cured, like HIV. Understanding how these infections are transmitted is crucial to protecting your health and the health of your partner. In today's video, we're going to discuss different types of infections that can be transmitted through sexual contact, focusing specifically on how HIV is spread during sex. This information is vital for anyone who is sexually active, as it can help you take the necessary steps to stay safe. First, let's talk about sexually transmitted infections, or STIs. These infections are caused by bacteria, viruses, or parasites that are passed from one person to another through sexual contact. Common STIs include chlamydia, gonorrhea, syphilis, herpes, and of course HIV. STIs can be spread through vaginal, anal, or oral sex, and sometimes even through skin-to-skin contact in the genital area. Some STIs, like chlamydia and gonorrhea, are bacterial and can be cured with antibiotics. Others, like herpes and HIV, are viral and cannot be cured, but they can be managed with medication. Contracting an STI can be emotionally and physically challenging. The stigma associated with these infections can lead to feelings of shame, fear, and isolation. Physically, STIs can cause a range of symptoms, from discomfort and pain to long-term health complications if left untreated. Pause for effect. That's why it's so important to have open, honest conversations about sexual health and to understand how these infections are transmitted. Knowledge is the first step in protecting yourself and your partner. Now let's delve into how infections are transmitted through sexual contact. While the specifics can vary depending on the infection, the general pathways are similar. Let's break it down. During vaginal sex, infections can be transmitted when certain body fluids, like semen, vaginal fluids, or blood, come into contact with the mucous membranes in the vagina or penis. This is the most common way many STIs, including HIV, are spread. For women, the virus or bacteria can enter through the lining of the vagina or cervix, and for men through the urethra or any small cuts or sores on the penis. Anal sex is another common route for STI transmission, and it's actually the highest risk sexual activity for HIV transmission. The lining of the rectum is much thinner than the lining of the vagina, making it more susceptible to tears and allowing viruses and bacteria to enter the bloodstream more easily. Whether you are the insertive or receptive partner, the risk of transmitting or contracting an infection is significant. Oral sex carries a lower risk of STI transmission compared to vaginal and anal sex, but it's still possible. Infections like herpes, gonorrhea, syphilis, and even HIV can be transmitted if there are cuts or sores in the mouth, or if the person performing oral sex has gum disease. The virus can enter the bloodstream through these open areas, making protection just as important. Section 3.4. The role of other STIs in HIV transmission. It's also important to note that having another STI, such as herpes or syphilis, can increase your risk of contracting HIV. These infections cause sores or inflammation, which make it easier for the HIV virus to enter the body during sex. This is why managing any existing STIs is crucial in reducing the risk of HIV transmission. Section 3.5. Shared sexual toys and HIV transmission. Another, less commonly discussed way that infections can be transmitted is through shared sexual toys. If toys are not properly cleaned or covered with a new condom between uses, they can carry bodily fluids that may contain viruses or bacteria, leading to transmission. This applies to HIV as well, so always ensure that toys are cleaned thoroughly or use condoms to cover them. Section 4. Prevention and protection measures. Understanding how these infections are transmitted is only part of the equation. The next step is taking action to protect yourself. Here are a few key measures you can take to reduce your risk. Section 4.1. Condom use. Using condoms consistently and correctly during vaginal, anal, and oral sex is one of the most effective ways to prevent the transmission of STIs, including HIV. Condoms create a barrier that prevents bodily fluids from being exchanged, significantly reducing the risk of infection. Section 4.2. Regular STI Testing. Regular STI testing is another crucial step in protecting your sexual health. Testing not only helps you know your status but also ensures that if you do have an infection, it can be treated as soon as possible to reduce the risk of complications and transmission to others. Section 4.3. PrEP and PEP for HIV Prevention. For those at higher risk of HIV, medications like PrEP, pre-exposure prophylaxis, can reduce the risk of contracting the virus by up to 99% when taken daily. There's also PEP, post-exposure prophylaxis, which can be taken after a potential exposure to HIV to prevent the virus from taking hold, but it must be started within 72 hours of exposure. Conclusion. Sexual health is a vital part of your overall well-being, and understanding how infections are transmitted through sex is key to protecting yourself and those you care about. By taking the right precautions, using condoms, getting tested regularly, and considering medications like PrEP, you can significantly reduce your risk of contracting or spreading an infection. Pause for emphasis. Remember, being informed and proactive is the best way to safeguard your health. If you're ever in doubt, don't hesitate to seek medical advice and support.